Dr. Nikhil Aggarwal is currently working with us as one of the best rated general physician as well as a diabetologist. Hi, Dr. Nikhil. We would like you to take this ahead for us.
Hi. So it's indeed a great opportunity for me to connect with everyone on this platform. Suji, my audio is clear and screen is visible, correct?
Yes, Nikhil, we can see the screen. It's
Okay,
visible.
please do let me know if there is any error. I don't want, to keep on speaking and without anything. Okay.
Yeah, yeah, sure, sure.
Yeah. So, welcome everyone to this amazing session today. So, today's topic of discussion will be the health problems in winters and maintaining good health during the winter season. And as you know, winter season will close soon and summers will also begin. And in the end of this discussion, I will also end few at some points regarding how you will tackle the transition from winters to summers. Okay, so that will be indeed a very beneficial thing for all of you. So let's begin. So today I will be talking about managing your health during the winter season, right? And we will discuss the common health challenges in winter and how to maintain good health during this time. And also we will talk about the changing season with the transition from winters to summers, right? So number one, so I get many consultations regarding these problems, and like in winters, even in summers, these are the topmost, I would say, problems which we encounter. So let us understand few things which will help you to see. Before we dive in, I want to understand that these are certain common entities which you should know how, like, what are the symptoms and signs you will experience in yourself, number one, and number two, how you will tackle each of them, and number three, how you will tackle the precautionary measures so that you don't get these things for quite often. Because usually what happens, you take the consultation on doctor 24/7, you tell your symptoms, you get the treatment, and that's acting as a quick fix. So for 5 days you feel better, and after 10th day again you book a consultation. So suppose if it comes to me, okay, so in that case you will say, so sir, so and so doctor booked the consultation, I got fine, now again I'm facing the same problem, please help me, what should I do? Now my main focus is not on giving you the medicine at that time. I first take the history. If you have already taken some antibiotics or everything, then I focus on telling you some precautionary measures, because that will indeed be helpful for you. So if we talk about those things in the end, that will be much more sensible to you. And you can please keep your questions on some notepad or something. I will definitely address to you in the last end of this session as Q&A session. Okay, so you can bombard me with all kind of questions you have. Okay. So number one, we will talk about the seasonal health changes. And these are the specific conditions which significantly impact our well-being and as well as the daily activities during the colder months, right? So number one, seasonal affective disorder, that abbreviated as SAD, that is sad. Okay, so sad to hear about this problem. I will talk about this eventually. Then you might have heard of the term influenza and flu. Okay. And then common cold, or you can say cold simply. These are the topmost problems which we encounter. And then very importantly, we encounter what is known as dry skin. Okay. And dry skin is not simply a two-word terminology. It encounters a lot of dermatological conditions which happen due to the dry skin. Okay. Including eczema-like conditions, and there is another entity, that is the respiratory tract infections, which is also accounted specifically due to this seasonal changes. Okay, so number one, we will begin step by step. Number one is understanding this SAD. So what is this SAD? As the name abbreviated as sad, you can remember that as the days get shorter in winters and there is less daylight, you begin to feel sad also sometimes. Okay, it eventually happens in when the winters is on the topmost condition. So this is a type of depressive disorder that occurs seasonally and typically during the winter months. So you might have experienced, I do get consultations experiencing that patients are saying, sir, I have low mood, there is lack of energy, and I am having lack of sleep or sleeplessness. So what should I do? Then I asked, do you have fever? They said, no fever, sir, nothing, just body ache, lack of energy, I'm not feeling like doing anything. So these are the common problems which I see in doctor 24/7 consultations, and mostly. So Also the thing is related to the appetite. So I hope you have yourself might have felt this, that either there is loss of appetite or increased appetite. Okay, so both are extreme conditions which are felt when you are extremely sad, and sadness may not be linked to only winters. It may be due to your personal stress, maybe work stress, or some family health issues, or some other personal agendas. So due to all these problems, you have another entity that is known as difficulty in concentrating. So I see 90% the consultations are mostly from working professionals. Okay, so mostly they are doing computer work, laptop work, and they face a topmost condition that, sir, we are not able to concentrate on our work properly. We try to do our work, but there is some or the other headache issues, or we are having body ache or lack of energy. We get up in the morning, we feel like I'm not fresh. I All these problems are very common, and especially these are on a rise when we talk about the winter season. Okay, so this is a creative which I have taken from the national health websites. So see, another thing before I proceed further, you tend to Google nowadays. Okay, so please, please, please pay attention and remember, I will repeat this statement at the end of my webinar also. Do not Google your symptoms. Okay, because a simple headache may turn out to be a tumor after half an hour of Google search by yourself. So we as doctors, yes, we do refer to the internet, but we have certain health websites which we refer, and we take down what are the important points in those. We don't see the other things which are irrelevant to your symptoms. Okay, so better you consult us rather than googling your symptoms. So in this seasonal affective disorder, do you have these mild symptoms that have lasted less than 2 weeks, like feeling down, okay, having trouble sleeping, having less energy than usual, and still able to do your job, housework, or schoolwork? Okay, so what activities can you do? So you can do something which you enjoy. Okay, maybe anything, any activity in the daytime that will give you a good, feeling, positive feeling of your day. And you should go outside in sunlight area. Okay, specifically, suppose if you're a working professional with a 9 to 5 job or 9 to 6 job, you don't have time to get out to the sunlight. In that case, what will you do? So in that case, I personally suggest and recommend you a very simple quick fix. In the lunchtime, obviously you have a lunchtime from 1 to 2 or something like that. Take out 10 minutes or 15 minutes of time. Take a stroll around your building, in outside your office, or maybe in the balcony area. Just go and have a talk with your friend, maybe a colleague, for 10 minutes, 15 minutes in sunlight. That itself will count, taking sunlight for some time. Okay, then spending time with family and friends. See, this is a one thing which I personally feel is the most neglected in nowadays. Okay, you don't spend your time with your family because you're too much overworked, overstressed, and you miss these things. So please do this, and it will actually give you a better immune response, also better health overall. Okay, then eating healthy and avoiding foods with lots of sugar. That is again an important point. I see there is a lightning rise in the number of Zomato and Swiggy orders. I hope you are all doing that. I have also done that. I agree. Okay, but you have to limit yourself. It should not be that every second or third day you are ordering from Swiggy, Zomato. And see, your main fix, which you when I ask you, have you been eating outside food? Yes, sir, we have been eating. Some people say, no, sir, we eat from very healthy restaurants. We are ordering from one of the finest and expensive restaurants. So please, I want to pop your bubble. Even the finest restaurants, they are also having reheated cooked oils. Okay, the cooking oils they might be using it repeatedly in sending you the food. Okay, so it may happen that you are having high cholesterol and other issues because of that also. So it seems that you are taking healthy, but it's not a healthy food. Okay, so best thing is which is in your kitchen. Okay, then do you have these more severe symptoms which have lasted more than 2 weeks, like social withdrawal? Then there may be, I told you, lack of sleeplessness, like lack of sleeping, but there may be oversleeping also. Sir, pura din I'm sleeping. I'm whole day I'm sleeping. I'm not feeling like getting up from bed. I'm like tired, feeling feverish, body ache. So that is also one of the very underlying reasons in this seasonal affective disorder. Okay, then many females contact me regarding this problem. They are gaining weight. Okay, even a slightest change in their weight can be it can be a normal thing, but when you are gaining more than 10 kgs weight or 5 kgs weight abruptly, like within 2 weeks or 3 weeks, which is evident from your well-being, so then that is a problem, and that may be something related to again this entire entity, the seasonal disorder. Okay. And craving with a lot of foods, like I think this is very clear to you. There is a cake and candies and cookies craving which everyone has. I have not added in this list the chips, okay, the Coca-Cola and all those things. So there's a lot of craving. Okay. Then what should you do? So you can seek light therapy. As I told you, go outside, have sunlight. That's the best therapy you can have. Or you can talk psychotherapy, or I would say talk therapy. And talk therapy need not be from a professional. It can be even your family member, maybe your sister, your sibling, your mother, your father. You can talk to them, and you will definitely feel better. Trust me. Then medications, if it is necessary, then definitely you should have medications for few months, not lifelong. Okay. Then vitamin D supplementations, that is very important. If you are not able to get enough vitamin D, then you can take some supplements, that is completely safe. Okay. Then the next entity after that was, I told you, common cold and influenza or flu. Okay. So let us see what are the basic differences between these three entities. Another entity which I have added is the COVID-19, because in some cases you were also worried, and I get a question that, sir, COVID to nahi ho gaya, I don't have COVID na. So that is also a thing which bothers your mind. Okay. So first, and understand what is the basic thing between the common cold and flu. Okay. You tend to use them interchangeably, and that is not correct. Okay. So you can face you can focus on some important things, like the onset of symptoms. Okay. So the number one is cold. So in this, usually I get a gradual onset. Okay. And in flu, you get sudden onset of symptoms. Achanak se, the history is like 1 day or maybe few hours history, and gradually the patient is saying that I'm getting this problem since couple of weeks or maybe 4 days, 5 days. I felt better, now again I'm feeling this problem. So that is a basic history which you get. Okay. Then another important entity is fever. Okay. So in common cold, the fever is quite rare, but in flu, fever is common. Okay. So that is the main thing which is differencing the two things. And similarly, COVID is also getting the thing, that is the fever. Okay. But for COVID-19, we have a specific test which you can go for. You already are aware. Okay. Then headache is a common thing to all of them. Okay. It can be present, it cannot be present in all of these conditions. So you should take care of this thing also, that headache primarily is not the only thing which is going to label you as COVID-19. It's not like that. Okay. Similarly, the only fever symptom should not be the main thing. Then what happens in fatigue and weakness? Okay, so that can be mild. So I can tell you overall in this flow chart that milder symptoms if you are getting, okay, and that too without fever. So your chances are more that you have a common cold. Okay. And if you are having flu-like symptoms, so that would encounter more of fever and other associated symptoms. Okay. So you can get all these other conditions like stuffy and running nose, sneezing can be there. Sore throat is very common in these conditions like common cold. And sometimes it is also seen in COVID-19, which you already know. Okay, cough is common to all. And very important entity, another thing which I want to highlight here is the shortness of breath. Okay, so please remember that breathlessness, saans phul rahi hai, there is problem. So this is quite rare in the first two categories, but it is common in COVID-19. Okay, again, it may not be present initially, it may happen after a later time, but yes, it is there. Then diarrhea is also a symptom which is usually seen in flu and COVID-19, but it is never seen in a common cold condition. Okay, so these are few conditions which might help you to differentiate your symptoms on yourself at your scale only. Okay. Then moving further, now we have talked about the symptoms, we know what is the problem. Now what's the solution? Okay. So how you will prevent this? See, important thing is vaccination. So I want to emphasize, if all of you have not got your vaccination done, especially of the COVID-19 vaccine, so please do get your 3 doses done. first dose, second dose, and precautionary dose. I do know many patients have not gone their precautionary dose, so please do that. It is very important. It will help you to get a good antibody titer against COVID-19. If in case the COVID-19 prevails again, okay. Then all of these things which you are already aware, practicing good hygiene such as frequent hand washing. This is a very small thing, and trust me, if you do it on a daily basis and frequently, you will prevent yourself from a lot of basic infections. And now the main question is when to do hand wash. So number one thing is, when you're coming home from outside your office, you're coming home, please, before touching any other thing, drop your bag at your place and do a hand wash, proper hand wash with any kind of detergent, okay, whether you're using Dettol or soap or anything like that, okay, but do it at least for a few minutes, okay. And then another thing, whether you have done your hand wash, please again, before you sit for eating, you should again do a hand wash, okay. Then after eating, you should again do a hand wash. So these are a few primary things. And then another thing which you might already have a habit of, that after you go to washroom, you do the hand wash. So that is a common thing which you are already doing. But before and after the meals, that is very important. And before you enter the house, you should have your mindset that I will not touch anyone, I will not hug anyone, I will just first do my hand wash, then I will take a sip of glass of water or anything like that. Even if your favorite person has come to welcome you in your home, okay, and he or she is giving you something to eat, so please take this one, please do not take it, it's my humble request, okay. So you might either take infection or give infection to your near and dear ones. Then covering the mouth when coughing or sneezing, that is extremely important, okay. And you tend to follow it, but sometimes you miss it, and that's the time when the problem happens, okay. And one more thing, during this webinar, if it would be good, please can everyone turn on your cameras. It will make this session more interactive. I will see the faces of people, and it will give me a boost up that yes, everyone is acknowledging my statements. So, Soji, can you help me regarding this? Please inform everyone to turn on their cameras.
Guys, can you please turn on your cameras, please?
Otherwise, it will be a boring lecture, which I don't want to do. Please, it's a webinar. Okay. Yes. Please, more
Very
people
interesting.
turn on your cameras. It will be a boost for myself also. I will see the faces acknowledging my statements.
Okay.
Okay. Then boosting the immune system through diet and a lifestyle. That is again a very important thing. Your diet, as I told you, emphasizing enough, diet is extremely important for you. Okay. And especially your plant-based diet and home-based diet. So think of a statement, and please always remember while eating that anything which is cooked outside your home kitchen, that may harm your health in the long run. Okay. So it's a single statement which can prevent your mind from frequently eating from outside, okay. So, and if suppose if you are on a trip, professional trip or something, and if you are in a wedding, okay, you have to mandatorily you have to eat from outside, so what will you do? So I suggest you that please have a portion size including more of salad, fruits and vegetables in your plate when you are outside, okay. Don't take too much or oily stuff and spicy food in your plate, okay. So that is another thing which will help you. Then what about how you will maintain your respiratory health? Okay, so I told you, you can prevent the respiratory infections by avoiding close contact with sick individuals and practicing good respiratory hygiene, which I just informed you in the previous slides. And another thing, indoor air quality and respiratory exercises can also help strengthen the lung functions, and they can reduce the risk of respiratory illnesses. Okay. So now what are the respiratory exercises which you can carry out on a daily basis? So as you might already know, deep breathing exercise is the easiest thing you can do. Don't need to go anywhere. Just sit at your place, in your professional place or any place where you're working, for 5 minutes on a daily basis. When you are alone, just try to do deep breathing, inhale and exhale, okay, in a deep breathing, okay. If simple thing, you do this with closed eyes, feel your breath, and that can itself increase strengthen your lung function. So sharing a personal experience on this, if you start doing this, you will feel one very small problem. You will not be able to do proper deep breathing. If you have never ever done this exercise, trust me, you will have trouble holding your breath, inhaling too much and exhaling too much. So initially you will feel problem, but eventually it will become habitual. Okay, so please try to do this, and it will help you solve many of the problems related to the respiratory health. Then nutrition and diet tips for winters. So what about the diet tips? People do ask me, sir, please give me some small tips to help me tackle this problem. Okay, so there is a concept of balanced diet, as you know. Now in balanced diet, you don't need to remember exact calories or everything. It's not going to work up. Trust me, you cannot count your calories on a daily basis or for every meal. Okay, but what you can personally do is try to include more of fruits and vegetables. So take this mantra in your diet: more fruits and more vegetables. And by this simple concept, trust me, you will tackle the problem of a balanced diet which you're not having right now. And in winters, especially, you should take all the high food rich in vitamins, especially vitamin C and minerals like citrus fruits and leafy greens. So I advise you, when you go to buy some vegetables and fruits, you will get a good variety. Okay, especially when you see the fruits market, you will see in winters they have specific fruits which are not available in summers, right? So that is itself a sign that please use them, and in good quantity on a daily basis. It's not that you are taking a step today, you are eating the good fruits today and you forget that for the entire week. No, you should incorporate, like suppose if you are buying an orange, okay, try to incorporate a healthy habit of taking one orange every day. Okay, fix your time, maybe post lunch, after lunch, anytime you get time, just fix your time, okay, that you have to eat this. So that will itself help you tackle these problems. Then another concept which you definitely forget is hydration in winters. You all know that you have to drink water, but I don't know why you don't drink water. Trust me and ask yourself one question: how many bottles of water have I drunk today? And the answer will most likely be either one or either two. It will not be more than two on an average scale. So please make a habit of drinking at least 4 to 5 bottles of 1 liter each. At least that's the minimum in the entire day. You can go up to 6 liters if you feel like, but the main thing is you have to go anywhere beyond 4 liters. That should be a minimum target. Okay, so stay hydrated by drinking water regularly throughout the day. Now, please pay attention even if you don't feel thirsty. So your thinking is, when I will feel thirsty, I will take the water. No, please don't do that. Okay, that will never happen. You're very busy. Okay, you're overworked. You have a lot of work to do in the entire day. So please keep on drinking water. And dehydration in winter, it increases the risk because the thirst sensation and increased fluid loss helps during through the respiration. That is the problem which you need to take care of. Okay. Then another thing which I see, the 90% problem in today's world due to westernization of the lifestyle, is the lack of exercise and physical activity. So again, ask yourself, how much duration in the entire day do you do any kind of physical activity? So I don't think so. The answer will be more than 30 minutes or 1 hour. Okay. So maybe sometimes you miss it, or some people may not have done it any day. Okay. So now I will tell you a mantra which you should know for any age group, be it an adult, be it a child, be it an old age. Okay. So first you should know that staying physically active in winter, what are the benefits? Only then it will make you targetable. It can boost your overall mood. That is number one. Maintain good energy levels, which is obviously the need of the hour. And overall, it will support your health. Okay. Now, how you can do these things? You can stay indoors and do certain exercises like yoga, or you can do home workouts or anything like that. Okay. Or such as outdoor activities like 30 minutes of daily brisk walk. that is also sufficient. You can go up to 45 minutes or 1 hour as per your liking. And if not, you can even do cycling if you are in a close society area where you can, you don't need to go outside the society area, then you can do this also. So these will help you to stay active during the colder months and even the summer months. Okay. Now, you might ask, ki, sir, I am wanting to do walk, but when to do walk? And I'm not getting time to go outside my home. So how to manage this? So I would answer that take in your home any place, be it balcony area or rooftop, or maybe in your own apartment, if there is a long area where you can do a walk. So please take 10 rounds, 20 rounds, 30 rounds inside your home also. That is also sufficient. That's not a problem. Okay. Even for not going, it's better than at least if you do this much. Okay. And another thing, that if you are doing brisk walk on a daily basis, you need to maintain it. Okay. So please don't do that. You are starting it, and then what happened, I don't know, in between you have stopped it, and then again you are having these kind of problems. So this simple activity will take care of your mood, energy levels, and also it will make you feel a good appetite. Okay. And also you will get a good sleep. That is also the added benefits. Okay. So, and diet, and plus your weight, body weight will also be maintained if you have a regular habit of doing brisk walk. Okay. So these are few things which you should definitely do, because in winters you do miss on these things, because boss, it's very cold, I can't do anything else. I can't even get outside my blanket. Sir, you are telling me to do a brisk walk, how it is possible? Okay. So that is why I'm telling you a quick fix. Wear your caps, your gloves, tight jackets. Okay. And go inside your home only and do a brisk walk. That's more than sufficient if you do it. Okay. Then another thing, the skin care in winter. So that is a very, very, very important entity which please you may need to pay attention. Okay. So as you know, cold weather and low humidity, they both can lead to dry, itchy skin, and they can exacerbate, you can say, increase the conditions that are known as like eczema. Okay. So how you will prevent these problems? So number one is, which you need to pay attention, is to moisturize your skin regularly. You can use any kind of skin moisturizers which are available over the counter. Okay. From any pharmacy. And you can do this when you feel your skin is dry. Okay. And also specifically after a bath or a shower, you should immediately apply moisturizer to your skin. So that is a very, very important thing which you should know. I see many people have raised your hands. Please don't worry. I will keep reserved last 10 minutes, okay, before 3 o'clock to and answer all your questions. Okay, so don't worry. So you need to take baths with take bath and shower. So I am highlighting this, okay, because in winters many people don't do this. Okay. So do take bath and shower. Okay. Don't forget this. Number one. Number two, if you take bath and shower now, very important, you should take with warm water, not hot water. So it should not be boiling water that you are splashing on your body, and that is not helpful. And trust me, that will lead to more exacerbation of the skin problems. Okay. So it should not be extremely hot water. It should be lukewarm. Okay. So you need to stay hydrated. I told you, drink at least 8 glasses of water. That will also indirectly help you to keep your skin moist. So that is another added advantage. Then you should wear loose clothes which are made of cotton and other natural materials. Now, suppose you have ordered not from Swiggy and Zomato, but you have ordered from Mantra or Amazon. What you have ordered, a new clothing, a very beautiful clothing in winters which you want to wear. Okay. Now what you will do, so I suggest you to please wash the new clothing before you wear it, because some people nowadays, they wear it and then they return the order due to the size mismatch, and that skin problem might travel to you indirectly and unknowingly. Okay. So there can be any kind of cause, and you will take a consultation on doctor 24/7. So I was fine, everything was working fine, I tried this new cloth, and I'm facing this all redness, bumps and itching and swelling on this hands. Now what to do? Okay. So the history is very important. Then you should avoid woolen and synthetic fibers, very synthetic fibers, that is damaging to your skin. And another thing which you tend to miss, there is a direct link between your skin conditions and your stress levels. Okay, so you need to manage your stress and emotional triggers. Again, stress can be managed how? By either taking a psychiatric consultation, medication, or you can even do meditation. Okay, so meditation will again you can sit in your workplace, in your home, and close your eyes and do deep breathing exercise, and let your thoughts come. Whatever you is coming to your mind, let it come. Don't chase the rabbits. Okay, just ignore the thoughts, and eventually you will feel your inner self to be better. You will feel that you are uh, good, your good overall mental well-being will be felt when you do this simple activity for 5 to 10 minutes. That is meditation. Okay, and that can help you relieve of your poor mental or emotional health. Any kind of physical stress or personal stress can also be tackled by this problem. And another thing, you should avoid irritants and allergens. So some things, some new cosmetic items which you might be using, that can cause irritation to your skin. So you should, if you acknowledge any kind of symptoms, any redness or itching in the skin after you apply the new cosmetics, so please avoid the use of them. Another thing, some people are allergic to eggs or other kind of issues which you can eat outside food. So if you encounter, please notice your pattern. If you encounter some food items, after eating some food items, you are specifically encountering these symptoms, so please target to avoid those eating things. Okay, because if you avoid those, maybe you can recover from your problems, okay, of related to the skin. So you will not need to book a dermatology condition, specific consultation for dermatologist. Another thing, so that India is most commonly getting to be a diabetic capital of the world. Okay, so we have a lot of patients who are diabetic. Okay, who are old diabetics and who are recently diagnosed diabetics. I have a tremendous experience to treat a diabetic. I have worked in a lot of hospitals. So I do take diabetes consultations also. That's my main workplace. Okay. So please, now another thing which you need to focus is the foot care. That is a very missed thing in diabetics. So diabetic patient needs to pay special attention to foot care in winters to prevent complications like frostbites and neuropathy. So neuropathy is a very big problem which the patients face because of uncontrolled blood sugar levels, and that leads to numbness, tingling sensations in the foot and the limbs. Okay, and that is easily tackleable by proper foot care if you do this in the early phases. Now, how you will do this? You should keep your feet dry and warm. Please remember these two terms, dry and warm. Okay, so it should not be moist. So suppose you have gone to a shower. After you come from the shower, you should make your feet dry. That's one thing which you miss. Okay, and another thing, you should wear socks while entire day when you are feeling extreme cold, chilly weather outside. So you should wear socks. There's no shame in wearing socks in the entire place. Okay, so that will keep your foot warm. Okay, and that too, take buy some woolen socks because that will be much more better. And wear proper footwear. Okay, so that is also important. You tend to save money by wearing the same footwear for 2 years, 3 years. Okay, but you don't want to save money by not buying a 600 rupees pizza from Domino's. I don't know why. So in that 600 rupees you can purchase yourself a very good general day-to-day activity footwear, which will help you relieve all your symptoms related to the pain in the ankle or heel pain and other problems. Okay, another thing, you should always inspect your feet daily for any signs of injury or infection. That is very important. And if you are attending this webinar and you are not diabetic but you have your family members who is diabetic, I personally want all of you to pay attention from today onwards to all the elderly people in your home who have diabetes, that you should inspect their feet on a daily basis. Because what happens in diabetes, you might be not aware that due to this neuropathy which is already set in, patients get injury on the foot and the bleeding happens, there's a clot, a wound happens, and they don't even come to know that they have a wound which is sitting in their foot. Okay, and that hidden problem, it aggravates to a very big extent, and then the elderly will come to you, to your family member, and say that now I am having pain, and then it will be a very later stage. So I want everyone to please every day have a look at the feet of your elderlies, so that you are excluding any kind of infection or injury to the foot. Okay, so your father may be going outside to buy some things out for your home, and accidentally he might injure his foot by putting his foot on some other things. Okay, so you should have a look at his feet on a daily basis. Then what about the mental health and well-being? So winters can negatively impact mental health, leading to feeling of sadness, loneliness, and increased stress, which I told you. And how you can prevent it? Socially connection and getting some good sunlight exposure, already told you, and you can take professional help if it is needed. Okay. Then another entity which is sleep. So most of the working professionals right now are sleep deprived. So I please want to recommend all of the working people and even the other people who are there, please and please make a good routine for your sleep wake cycle. Okay, so you should maintain a good sleep hygiene by creating a regular sleep schedule. Maybe you fix your clock from 12. Now acha, one more question which I face is, sir, how many hours of sleep is mandatory? At least 6 to 7 hours sleep on a daily basis is essential. Okay, so please pay attention to that and create a comfortable sleep environment. Okay, it should not be that everyone is waking you, or the door is closing and opening and you are having a disturbed sleep. Okay, so try to sleep in a good environment, close the lights, dim the lights, and then you sleep. Okay, don't sleep in good lighting conditions. Okay, like keeping your tube lights on and sleeping, that is also not a comfortable sleep. Then practice good relaxation techniques before bed to improve the sleep quality. Now, I want to know how many of you are actually using your mobile phones till the last minute before going to bed. I think 90% of the people are doing that. Okay, so I want you to please remember to limit your device usage to at least 30 minutes prior to sleep. Okay, so that your eyes get acclimatized and you can have a good night's sleep. So you need to mitigate these disruptions to sleep patterns during the colder months specifically. Okay, because in winters you are in your blanket and you're using your mobile phone, so that is the problem. Importance of these vitamin D from sunlight. So now, as you know, sunlight exposure is crucial for the body to maintain good, to produce the vitamin D. Okay, naturally, and the vitamin D, it plays an important role in maintaining bone health, supporting the immune function, and regulating your mood. Okay, so now in during winter months you get ample of sunlight, I agree, but there may be some regions in India where you don't get good sunlight exposure, or in your home which is in a high rise building or some place where you're not getting proper sunlight. So you need to find ways to ensure adequate vitamin D level is there. So either again you can go to rooftop or your balcony area where you can find your sunlight, or you can take help from the dietary sources. Okay, so like mushrooms, oranges, bananas, spinach, cheese, these are few of the items which on a regular basis you can take, and this will help you take at least some amounts of vitamin D in your diet. And if not, if you're checking your blood test and you're getting vitamin D levels are low, then you can go for supplementation also, which I told you in the beginning of this webinar. Then what are the safety precautions in winters? So these things we have already discussed. Now another thing which you miss is you need to prevent the slips and falls on other icy surfaces. Okay, so there may be some surface where you might be slipping, and you know that in winters if you slip from bathroom or any place, your pain is very much felt. Okay, very good. So you should wear appropriate footwear and use handrails while you're traveling somewhere also. Okay, so that can be done. Another thing, you should have safe heating habits. So what do I mean by this? You are using, many of people are using heaters while you are staying indoors. Okay, maybe in your workplace or in your home. So you should ensure you have a proper ventilated area where you are using the heater. It should not be closed from all the sides and you are using the heater and accidentally if you are sleeping, that would be a disaster and it would lead to a fire hazard in the area. I have had many of the reports, okay, which are experiencing this problem of fire hazards due to the heater problem. Then dressing appropriately for cold weather. You should, there's no shame in putting full cap on your head and covering your head when you're going outside. So please, because head is one thing which through which you can get like from the ear you can get cold weather, cold winds which can harm your health. So please keep your head covered, your ears covered when you're going outside, because that can be a problem for you. Then importance of regular health checkups. So regular visits to your health doctor should be good for preventing and monitoring of these chronic conditions which may be underlying and causing these problems. You can schedule follow-ups and checkups during winter season to address any health conditions proactively and ensure optimal health throughout the colder months. Okay. Then you can also follow some COVID-19 precautions as amidst the seasonal health changes challenges. Now you know that wearing masks is essential. Then practicing social distancing is another thing. And important thing which I told you in the beginning, getting vaccinated is a very important thing which you miss. Okay. And you should do all these things to reduce your risk of COVID-19 transmission during the winter months as well as the summer months. Now, please pay attention. As you know, eventually we are transitioning from winter to summer. Okay. So now, as the temperatures are rising, it is very important to adjust the health practices accordingly. Now, as you know, the temperature is rising. Gradually, you should increase your physical activity levels because that is very important to tackle this problem. And again, in summers, same thing, you should stay hydrated. Okay. And your skincare routine should also be adjusted to protect against the sun exposure. Okay. So you can use good sunscreens while you go in the extreme summer weather. Now, in summers, which will be coming approaching soon, there are certain tips to remember. You can use sunscreens, you can wear protective clothing, you can seek shade during the peak sun hours. Okay, so that is also an important thing. Excess of everything is bad, right? So, excessive sunlight will also be harmful, especially in the peak sun hours in the extreme afternoon. And you need to, again, I'm emphasizing it repetitively, you need to stay hydrated. Okay. And especially when you are spending time outdoors. So suppose if you're going to for a family vacation or outside and you're spending your day from morning to the evening, so I suggest you carry water bottles with you and drink a lot of water. Okay. And you should also be mindful of the heat related illnesses. So what are these heat related illnesses? So you should know that there can be either heat exhaustion and there can be heat strokes, which can be coming soon. Okay. So you might be experiencing heavy sweating. There can be cold, pale, clammy skin with fast, weak pulsations. Okay. The radial pulse. Then there can be tiredness, headaches, dizziness. Okay. And on the extreme, there can be a heat stroke condition where which is accompanied by high body temperature. Again, there can be dry, damp skin, there can be strong pulsations, confusions can be there in your mind. Okay. Then you might also lose consciousness if you are exposed to heat stroke. Okay. Then there can be again headache, which is a common symptom for any kind of heat problems. Okay. And another thing, dizziness. Dizziness is also a solo condition which I feel many people have been reporting to me. So now how will you beat the heat? So extreme heat related problems you should be treating very aptly. Now number one, who are more predisposed to these kind of problems? So the children are most likely to have problems like in assembly when they are standing, they can have epistaxis, that is the nosebleed, they can have heat stroke. Okay. And older adults, elderlies, okay, the children, extremes of age groups, the children and the old age. Okay, so those are very highly vulnerable age groups. Then outside workers, then people with disabilities. Okay, so these all people need to take care a lot regarding the extreme weather which is going to approach very soon. Okay, and where you need to pay attention more, so there can be houses where there is little or no air conditioners. Okay, so in those areas you need to be very specifically following all the precautions like drinking extreme water, a lot of water that will help you keep hydrated and beat the heat. Then cars. So immediately when you enter your car, which has been there sitting in the sunlight for longer duration, so please I suggest all of you to immediately not go and sit inside the car. Unlock the car, open the gate, and wait for 5 to 10 seconds or at least 20 seconds. Okay, you can carry your belongings or do some mobile work, but please wait for 10 to 15 seconds, because that will help to allow the all the heat to dissipate from the car which has been collected inside for long hours. Okay, so that is very harmful for your health. And there can be construction work sites which you should take care of to avoid, okay, during this time. So I told you you should stay hydrated with water and avoid extreme sugary beverages. Now, which is the topmost sugary beverage which you love? That is Coca-Cola, Thumbs Up, and all these things. So please know that these are not good for drinking, staying hydrated. No, taking excessive sugary beverages, that will lead to a lot of problems. Diabetes is one thing, but you will not feel hydrated. In fact, your hydration will be on a lower scale if you do these things. So please take simple normal water, mineral water, that is sufficient. And you should stay cool in an air conditioned area if you feel like. Okay, and wear lightweight, light colored and loose fitting clothes. Very important, loose fitting clothes, because if you wear tight fitting clothes, it will lead to all the other problems in males. That there can be jock itch, that there can be secondary bacterial infections, there can be fungal infections in the genital area. So there can be a lot of problems if you wear tight clothing in winter, in summers. Okay, so now to summarize, we are almost in the end of the discussion. So we are left with 10 minutes, last 10 minutes. So summarize and conclusion, we have discussed common health challenges in winters and also strategies for maintaining good health during the colder months, right? So as we transition from winter to summer, it is definitely essential to continue prioritizing your health and well-being, which I have told you, explained you enough. And you should implement all the tips and tricks and strategies which I have discussed till now throughout the year. So please pay attention. It's not about summers, winters, rainy season. No, you should follow all these things throughout the year to maintain optimal health in every kind of season. Okay, so that is very important if you take care. So thank you all for attention to this webinar. So now the house is open for any kind of questions which you might ask. I am Dr. Nikhil Aggarwal, which I have been introduced in the beginning only. Some of people have joined in the later. And so now any kind of questions, please, you're most welcome to ask me.